Hello, my name is Linda. I am a pharmacist at Palisades Pharmacy. Nessa has asked me to do a short presentation in regards to COVID-19, and my hope is to have a candid talk about what COVID-19 is, what its impact on our body and our mental health, and what we should do to try to help minimize infection, and considerations about how you can go about your day to protect yourself when the isolations are lifted, because unfortunately the infection, COVID-19, is not going away in anytime soon, and so we need to be able to be knowledgeable to help protect ourselves and protect others while we start to get our life back to new normal, so to speak. I do have slides for this presentation. Unfortunately, I don't know how to put it onto the screen as I talk, so you can look at me in my backyard while I do my talk. The slides are also available as well, and you can peruse through them at your leisure, but they are not necessary for this talk. I just wanted to have the information there if you want to have it onto your screen and have some legible text there in case that it was not clear. So COVID-19, just to start off, is a coronavirus. A coronavirus is pretty similar to our common cold. So it's not the same as the flu. The flu is a different type of virus, and that's what we would get our flu shot every year in the fall. Coronaviruses are a different structure. They tend to cause respiratory infections, depending on how severe it would be. Your common cold is quite not severe, and then we see more severe, such as MERS and SARS. So it can have quite a big difference between the mild and the severe. Now, when we talk about COVID, it's that whole spectrum. It's not just the common cold where almost everyone has mild symptoms. You kind of feel crappy for a week. With COVID-19, there are some people who are non-symptomatic, asymptomatic. You don't feel anything. You don't even think that you're sick, and you have no idea that you are still shedding the virus, and you can go from asymptomatic to very, very symptomatic, very severe disease where you are unable to breathe, and you get everything in between. So that's the difficulty with this virus. One of the difficulties with this virus is that it's really hard to tell who has it without actually testing sometimes, because it can have a whole gamut of different presentations. So one person may show up with these symptoms and another person with another, and they're both still infected with COVID-19, yet they present very differently. So one person will not be the same as the other. The most common symptoms you have already heard: fever, dry cough, and tiredness and fatigue. So those are the most common throughout all of them, but it does not mean that if you don't have all three of them, or you only have one of them, or one is severe and one is not, like it really doesn't show. But those are the most common. There are some other less common things, such as headaches, aches and pains, joint pain, congestion, headache, conjunctivitis, which is redness in the eyes, sore throat, diarrhea, and even these little dots that are on on the toes and the fingers that discolor. So that's been shown in about 10% that we've been seen of patients with COVID-19. There are people who've lost their sense of smell. All of these presentations are so different between one person and another. So if you are seeing any of these symptoms, especially of the fever, dry cough, and tiredness, but even if you're getting some of the other symptoms that are unexplained, then it is definitely worthwhile to go and talk, not go actually, to talk to a healthcare professional, whether it is to call your pharmacist or call 811 in regards to getting a assessment done, just to see, do you show signs and symptoms of COVID-19? Is it worthwhile to get yourself swabbed and checked for COVID-19? I know a lot of people are still asking, have you been traveling in the last 14 days? Have you seen someone who traveled in the last 14 days? That really isn't applicable anymore. Right now, COVID-19 is community spread. That means that it is being passed on within the community, not from just getting the disease from somewhere else and bringing it back here. There hasn't been any travel for the past 2 months anyways, so we need to be more vigilant about these symptoms. And if you do have any of these symptoms, it is well worthwhile to give 811 a call or your pharmacist to get screened to see if you do need to get swabbed. The reason why that we want to swab as many people as possible now, one, we have the resources to do it. Right when COVID-19 first started, there was a little bit of a shortage in some of the supplies to help test everyone, and there was a bit of a panic at that time. Everyone wanted to get tested, and there really wasn't a need for every single person who had any kind of symptom to get tested. Right now, our resources are fully available. Our healthcare system is very manageable, and in order to keep this this COVID-19 pandemic contained, we need to know who has the disease or not. So if you do have symptoms, do please give 811 a call. Even if they are minor, you may want to just give them a call anyways to get yourself swabbed. You don't need to go anywhere. You don't need to go to your doctor's office. You don't need to go to the emergency department, but you do need to monitor your symptoms just to know how they are, what your fever, if you have a temperature, what that temperature is, and if that cough is there, if it's getting worse, if it's getting better. We do need to know these types of information, and then stay home. Even let's say if you do have a cold, you don't want to be spreading that cold to someone else, but if you have COVID-19, you definitely don't want to be spreading it somewhere else, to any other loved ones or whatnot. Most people, so by far 80-90% of the population, are going to recover from the disease without needing any kind of hospital treatment, without needing any kind of other treatment whatsoever. But there are people who do get seriously ill from this. They do need to get hospitalized. They may need to go to the ICU or get a ventilator because they're having such difficulty breathing. So that's the reason why the government has put in a lot of precautions in order to make sure that the people who do need the hospital beds and the ventilators and the ICU rooms, that they're able to manage those. So who tends to be the people who get into the hospital? It's by far mostly older people with underlying medical conditions. As you get older, your immune system isn't as good as if you were younger, and unfortunately that causes your body not to be able to respond to fighting the infection as well as if you had a better immune system. So any kind of medical conditions that cause your immune system to fall, to be weakened, those are the ones those are the people who are going to be at higher risk. So we're looking at people who have diabetes, because diabetes weakens the immune system. People who have cancer have a higher chance of getting more complications from a COVID-19 infection. People who have lung disease are going to be at higher risk because they're going to have difficulty breathing with a respiratory infection. It tends to cause pneumonia in the people with lung disease especially. So people with heart conditions, heart conditions not necessarily weaken the immune system. A lot of times diabetes involved, but just a heart condition, we've seen that COVID-19 may have a link to possibly damaging heart tissue. And so there is a link between COVID-19 infections and heart disease. So they are also at higher risk of having complications with COVID-19 infections. So those are the people that we are most concerned about, because those are the types of people who are going to end up going into hospital and needing extra care with a COVID-19 infection. Does that mean that everyone else is safe? No. As you've seen, there are younger people who are going into hospital. There's younger people who are still dying, but unfortunately, the vast majority are the older people. We've seen that in Europe, where Italy and Spain, where there's lots and lots of old people there. We have a very large elderly population in Italy, and so we've seen a lot of deaths in Italy due to that. So it goes to show that everyone who is older, who has medical conditions, should be hypervigilant. But because this infection can be spread through asymptomatic carriers, it wouldn't be carriers, people who are infected but who are asymptomatic. That's the dangerous part about this infection, because the people who don't know who have it will give it to the people who can seriously suffer from it. And that's by far, for me, one of the most scariest things. With SARS, the death rate, the mortality would be called, is actually higher than with COVID-19, but anyone who had SARS showed symptoms right away. You knew to isolate them, and then they wouldn't be giving it to anybody else. With COVID-19, this infection, because people don't know that they have it, they're shedding the virus to people who can get infected without even realizing it, without meaning to harm anyone. And it ends up causing so much spread of the disease. So at first, we saw some infections in a nursing home where the grandchildren who were infected did not show any symptoms. They just came back from traveling abroad, and they brought it back to their grandparents in a nursing home, and that's how it starts spreading within the nursing home. There was no ill intent because of it. It's just a very sad case, and it just keeps spreading. So that's the reason why this disease is so dangerous. So what can we do about it? Essentially, the government has already said, please physical distance. Why do we physical distance? It's because this disease is spread through our respiratory droplets. So essentially our saliva. Every time we talk, every time we sneeze or we cough, there are saliva droplets that go spraying everywhere. So when we talk, there's much less of it. When we sneeze, there's a whole lot of it coming out. When we cough, a lot of it's coming out. So that's the reason why if we physically distance, even as I talk, you're not getting the saliva that's coming out of my mouth landing onto you. So can I get it by any way else? Well, possibly, but the majority of the cases are through respiratory droplets. So that's the reason why we need to physically distance, is because my spit's not going to be shooting out meters and meters. It's not going to be sitting in the air as I talk. Saliva droplets tend to fall with gravity, so wherever it sits, it will linger there. Now, when it gets into, when we talk about spreading it, it needs to get onto one of our mucous membranes. So essentially, we need to have someone's spit coming into our mouth, into our nose, into our nasal passages, or into our eyes, and that's how it gets into our body. So when we talk about washing our hands, because we touch our faces all the time without even realizing, just a little rub of a nose, just a little scratch of the cheek. We do this subconsciously. We do not realize how much we touch our face. And so if we were to touch something that had someone's saliva droplets on it, if someone sneezed into their hand, put it on, like open the doorknob and you touch that doorknob, you could ultimately have that virus on your hands and then spread it all over your face, possibly, or all over somebody else. Let's say if you're you're babysitting a grandchild and you start wiping their face, that could just spread the virus everywhere. And so that is the reason why hand hygiene and physical distancing is the most important. So when we do talk about hand hygiene, we want to be very, very vigilant about washing our hands. So I've been asked this many times at the pharmacy, what's the best way of washing our hands? Should I wear these gloves everywhere I go? So I have these in the pharmacy. They are for me to stop any kind of spread of infection or of any bodily fluids when I do injections. They are meant as a physical barrier. They are not by any means going to stop myself from touching my face. It's not going to stop myself from, let's say, sneezing into my hand or touching a doorknob and then spreading it somewhere else. So this glove does not protect me in any way that will stop me from getting the disease. The only thing this does is it makes it a little bit easier for when I leave a store and I can just go like this and say bye-bye infection. But if I had took that glove and wiped my face with it, or which I've seen pictures on the internet of people still doing what they usually do with their hands and rubbing their face with their glove on, it essentially has not done anything. And if people feel like they are being more, feeling more secure about it, and they're just wearing this everywhere from one place to the other and skipping the hand hygiene, this can actually be more dangerous, because you think that you're safe, but you are not, because you're still touching yourself with this glove. So how do we keep our hand hygiene? We wash our hands. There are studies to show soap and water, 20 minutes of lathering up and getting every nook and cranny of your hands is by far the best way of washing your hands. By the rubbing, you're physically actually removing the virus and scrubbing it off of your hand. Plus the soap, it doesn't even need to be antibacterial soap, it can just be regular soap. It really does get rid of any kind of bacteria or viruses that are on your hands. If that's not available, so let's say you've just done grocery shopping and you don't have soap and water available to you, then alcohol hand sanitizer is where you do want to go. So Alcohol sanitizer is a mixture. It's usually between 60 and 95% of alcohol. And that percentage is actually very, very, very important because alcohol, what it does is it denatures the cell membrane. So it essentially dries out the cell membrane of a virus or a bacteria. It needs a little bit of water for it to get into the cell membrane. And that's why you can't use 99% isopropyl alcohol or 99% rubbing alcohol. That stuff is all alcohol. It can't actually penetrate the cell membrane without that little bit of water. That's why its maximum percentage can only be 95%. If it's higher than that, it's actually not going to work as a disinfectant. But if you go too much water and we dilute the alcohol way too much, then the alcohol is not going to be able to work. So there is a very good percentage that you need to follow with this. Now, there are tons of different do-it-yourself alcohol sanitizers to use to essentially make your own, so that you're using your own rubbing alcohol and making it into a gel or like a solution that is a little bit thicker than just regular alcohol. With those, please, please, please be very careful about the percentages because a lot of people are using 70% isopropyl alcohol or rubbing alcohol, and they are diluting it under 60%. They're adding different aloe veras, different essential oils to make it smell better, to help possibly fight the infection better. But once you get under that 60%, it's useless, and I do not want you to be using something that is not going to help you. So if you are doing your own DIY, or if someone's done their own do-it-yourself alcohol sanitizer, please, please, please check the calculations. Now, am I going to expect that you should know the calculations or how to do the calculation? No, that is something that I do in my job to make sure that these calculations are correct. So if you are doing some DIY or do-it-yourself alcohol sanitizer, please check with a healthcare professional, check with your pharmacist, because they'll be able to make sure that your concentration of alcohol sanitizer is actually going to be effective for killing off any of the virus or bacteria or microbials that are on your hand. So how often do you do this? Anytime you touch anything, or if you're planning on let's say if you're at the supermarket and your nose is incredibly itchy and you do need to rub it, make sure that you use this. Let it completely dry before you rub your nose. And why I say let it completely dry is because alcohol works when it's drying. It does not work when it's still wet on your hand. So if your hand is still wet from the alcohol sanitizer, it has not worked yet. You have to wait for it to completely dry before that the alcohol has done its job. So please, those are my tips about alcohol sanitizer. It is not the be-all and end-all. It is something to help when you are out and not able to use soap and water. But please use soap and water if you possibly can, because it is a better use of resources. Alcohol sanitizer is not readily available. It comes in and out depending on demand. I have started making it within the pharmacy, but it ends up costing a lot more, and it's not as financially feasible for most people. So we do want to preserve this for when we do need it. So use your soap and water, but if you are out, please use this liberally, just to make sure that you do keep your hands safe. Now, how much you need? Just the size of a dime, just a little dollop the size of a dime should be enough to cover your hands, and then make sure it dries. So make sure that you are also doing any kind of physical distancing. So that's the second measure for trying to prevent any kind of infection, contamination. So physical distancing is what it means, physical distancing, at least 1 to 2 meters apart. The WHO is recommending it right now at least 1 meter apart. The government of Canada is suggesting 2 meters apart, 6 feet between yourself and others. Now, why is that the distance? Is because, excuse me, if I were to sneeze on you, likely the distance of my spit particles coming at you is about 6 feet or 2 meters. So that's the reason why we do that. Is it excessive? I would say probably not. I think people can actually sneeze even farther than that. So you do want to keep that distance between you. The 1 meter is essentially to help with any kind of, as we talk to each other, we'll have those spit particles flying at each other. You may not notice that there's more spit particles with some other people and less with some more quiet people, or just the way they talk. But we do want to keep that distance to minimize any kind of spit coming back and forth to people. So one thing that you can also do is just avoid crowded places. If you have a lot of people in one room, it's really, really hard to stay apart from each other. Try to find places that are a bigger distance, or what I mean, a little bit more spacious, so that it's a lot easier to walk by each other. Because as you walk by each other, if you're unable to maintain that 1 to 2 meters apart, you're going to be going into someone else's bubble per se. So that's the reason why we want the physical distance. It does make a huge difference. Now, I want to applaud the city of Edmonton for what they've done in trying to minimize any kind of crowded places, minimize people interacting with each other. Edmonton shut down its rec centers, all of the public spaces very early on in the pandemic, and so that's the reason why, one of the reasons why Edmonton has much fewer infections than even, let's say, Calgary. Calgary, there's about I think 8 times more infection than Edmonton. And there are multiple reasons because of that. They do have more international travel, but they also closed down their public spaces about a week after Edmonton did. And we do know that makes a big difference. So having people not interact so closely with each other has made a huge impact on how many people have the infection and how many people have ultimately suffered consequences due to it. So that's why everybody's staying home. Visiting is done to a minimum, kept at a physical distance. Everyone's doing Zoom meetings right now because, or like some sort of online platform for being able to chat with each other and maintain some sort of connection with other people. Because the more that we get together and see each other, we've seen tons of infections within families, just family get together. You think that the other person is not infected, they're not showing symptoms, but that's the dangerous part about this disease, is the person who has the infection may not even realize it, and they will be spreading it. And so I know I'm repeating that fact, but that's the dangerous part about this infection. When we start opening up again, we're possibly going to see a resurgence of more cases. So if you still can, try to stay home as much as you can, especially if you have symptoms, but particularly you must stay home if you have any kind of symptoms. But if you don't need to go out and see other people or get into any kind of crowded spaces, then we're going to help protect that, minimize that chance of getting somebody else's spit particles with the virus on them. Now, there's been a whole big confusion about masks, so what we call barriers. So you'll see in all the supermarkets, all the stores, all the pharmacies, even in my pharmacy, we have plexiglass up. And that's to help as a barrier from protecting ourselves from any kind of spit particles coming to and from while we're talking with each other. So that's actually very important. So that's one form of a barrier, but you can't actually have a huge like box cube of a plexiglass around yourself as you walk around. So there's been the question of masks. Now the WHO, the FDA, Health Canada has always originally had said no masks. The masks are only for healthcare professionals and only for people who are sick. But because now that we know that spread is from asymptomatic carriers, we now know that we do need to make sure that there's a barrier between the person who is possibly infectious from spreading it otherwise. So this mask, so this is a medical mask, or a surgical mask if you want to say. These are going to be a barrier between your mouth and your spit particles going out to anybody else. Now, here's the confusion with everything, because will this stop you from getting infected if someone who is infected coughs on you? It will lower the chance, but it is not 100%. The 100% is if you're fully gowned with with a full disposable gown that's impenetrable, with not a surgical mask but an N95 or a physical face shield. Essentially, you need to be in a hazmat suit walking around the grocery store to get 100% protected. Where these masks are very, very effective is if you are the one who is sick and you put this on, you're essentially stopping any of your, well, not any, but most of your spit particles from leaving this mask. The reason why you're not 100% protected is because once I put this on, I still have my eyes open to having infection come in. This mask is not completely sealed. So you'll see that there's little holes here, and if I didn't press down these masks and I didn't fold this down, I actually have areas where the virus can still come in. So that's the reason why this is not 100%, but it does help. It does not protect you completely. So where it's very helpful is if you are the one who is sick. All of your spit goes into here, and it doesn't go out to anywhere else. So I did see a diagram online. I found it quite humorous, but also very effective to show, explain why masks are very helpful. So if you, let's say, have a person who, so we have two people standing right beside each other and we don't have any pants on. Just humor me. You have two people standing and there's no pants on. If one person starts urinating and pees onto the other person, you're going to get infected. Now, if let's say this guy is the guy that's infected and this guy is not. If this person wears some underpants, let's say that's being your mask, they're going to stop their urine from getting peed onto here, this guy. Right? So we're stopping the pee from coming out. It will just get absorbed from their underpants and it will just go down. Will there be some splash? Maybe if his pee is really, really forceful and he really had to pee so bad, it might still come out past his underpants and maybe get onto the other person, but it won't. But if, let's say, this person, the uninfected person, was the one who had underpants, and the person who was infected did not have underpants. That guy can still pee onto this person, and you would still get wet. This guy would still get wet. You could still have some of the pee touch the other person's body and infect the other person. Will it protect? It might not be that strong. Maybe that person didn't have that much pee, and so only the underpants got wet and not the body, and then didn't get infected. So that would be a person who has very low viral load, not very infectious. But they can still get, if let's say the person had high viral load, essentially very infectious, and they peed and had a lot of pee come onto this person's still going to get sick despite having the mask on. Now, if let's say both of the people had masks on, so if this guy had a high viral load, let's say had very strong pee, peed past his pants, and then got onto here, there's not that much getting onto this person's mask or underpants, and so they will have a lower chance of getting the infection. So that's the reason why, if everyone has a mask on, doesn't matter who's infected, you're still going to lower the chance of that other person being infected, because there are barriers to help protect. Which comes to my second part of discussion, is fabric mask versus surgical mask, because these, for one, are in short supply. We don't have a lot of these to go around, and yes, they are incredibly expensive now. They are going for at least $1 a mask now, so a box of 50 is at least, if you can find it anywhere, for at least $50 a box, if not more. I've seen them up to $100 a box, if you can find anywhere that has it. So if you can't get one of these, then can you use one of these? Or let's say a scarf or whatnot. So we'll talk about the different types of fabrics, because there are N95 masks, which I don't even have a sample to show you because I don't have one. Those are meant for healthcare professionals in the hospital. So what does the N95 mean? So the 95 means that 95% of the particles airborne are blocked by the filter, or essentially the fabric of the mask. These surgical masks, they're, depending on how well you wear them, if it's fitted well onto your face, they're going to block about 80%. So not quite as good as 95, but 80% still pretty good. So that's where surgical masks, or these masks, are, how they are effective they are at blocking anything from coming in. So fabric masks. This is one I've actually made for my daughter, because these masks are way too big for children. And so these masks here, depending on the type of fabric that you use, can be pretty effective. So there was a study done last month to test the different types of materials that these masks can be made out of, and see how well they work. Now, the best that this study had shown was 2 layers of quilting fabric, or a layer of quilting fabric and a layer of flannel, was almost just as effective as a surgical mask. So if you have a quilter around that is willing to make some masks, then 2 layers of quilting fabric will do probably pretty good for you if you can't get yourself one of these. Now, what if you don't have quilting fabric? I can't really go through every single material, but when we look at common sense, if you can see through the fabric, so if you put your fabric right up to the light and you look through it, if the more light that you can see, the less it's going to filter for you. the less light that you can see as you put it up to the light, that means it's going to be filtering more of anything going through, and it'll be more effective for you. So the ones that don't let any light through, like even if you take a black fabric, you'll still see some light coming through. It doesn't necessarily have anything to do with the color, but when the light comes through, you will see even with black fabric light coming through. The less you can see, the better it is. Quilting fabric tends to have the fibers quite close to each other, so that's the reason why it can be a bit more effective. But let's say you had a scarf, a bandana. Bandana typically has a little bit, the fibers are still very close to each other. Scarves are a little bit less effective because their fibers are usually tend to be a little bit more looser. T-shirts could work even if you tried. T-shirts are not as effective as quilting fabric because it's typically elastic, and it allows for the fibers to stretch and be essentially opened up. So they're not as effective, but even if it is able to filter, let's say 40%, 30%, that is better than having nothing on your face where it's filtering 0%. That you can already tell is better than nothing. The type of design that you have generally does not matter. If you have one that looks just like this, these masks tend to have just a little bit of extra space on the side. I've made this one with the intention that there's a little bit less space on the side here so that there's a little less air, but that typically doesn't end up being a huge problem. And then making sure that it is actually snug to the face. So there you can either have loops on the ear, or you can have a double loop longer that goes around the back of the head, so that it stays snug. So if it's not actually snug to the face, it's not actually going to be doing very good. So make sure those are the couple things that you do need to think about when you do get a mask. It's nice to see if you can get a metal little thing to help press it against the nose. What I've actually used is a twist tie. It actually works pretty well, especially for my daughter. Even use like a couple twist ties. It will give a little bit of structure so that it fits onto the nose, and making sure that it goes under the chin as well. This would definitely be a little too small for me because it wouldn't go under my chin, but there's a little flap here that goes under the chin, so it protects anything that will come up and into the mask. So do try to wear a mask if you can, or at least some sort of face covering, so that you're protecting your nose and your mouth, so that any kind of secretions or saliva will be stopped by the mask. Now, these fabric masks can be washed. It can be machined or hand washed every day, so that any of the saliva that does get onto here can be washed off. And it's very nice in that fact. If what you have is a surgical mask, these surgical masks, when you're done using them, if that's all you have, do let it dry completely. So usually that takes at least 24 hours, if not 48 hours. So let it dry completely for 1 or 2 days, up to 3 days, so that it completely dries before you use it again. Another thing to think about when you're wearing masks is that a lot of people think that because they have a mask on that they're immune to touching their face. You'll put the mask on and start adjusting the mask on your face because it's a little itchy, or if it's not fitting very well. But every time you do that, that means you're touching your face. It means you need to hand sanitize before and after you rub it, because let's say if someone did get any saliva onto your mask, if you touch your mask, you're getting the COVID-19 onto your hand. Just think about like those fluorescent dyes or whatnot that if you were to touch it, it's just going to get all over your hands. And if you didn't wash that off, you're going to be able to get that into your face, onto your eyes, into your nose after you take off your mask. So when you take off your mask, that also goes to show that you need to take it off, wash your hands before taking it off, so that let's say if you do touch your face, it doesn't infect you, and that if you touch any of this, you still need to wash your hands after. It seems like a double-edged sword where you have to keep washing your hands all the time, but if you think about infection control, you do have to be extra vigilant, because these viruses, they're not going to jump. They can't move themselves. They can only move if you touch it and if you move it. So if it was on here and I rubbed it with my hand, it's on here. It's not going to jump from the mask to my hand, but if I touch the hand, I've done the moving. So you have to be able to wash your hands before and after, and then do not adjust your mask while you have it on. That's the reason why originally they were saying it's more dangerous to have the mask, because people are touching their masks and they're not washing their hands, and they're going to just end up causing more infection because they think they're safer with this. They're not going to wash their hands as often. So we don't want that happening. So a few things that you should be aware about with using a mask, okay? So with those aside, a few things that we want to talk about is the day-to-day activities once Alberta starts reopening the economy. We're already going grocery shopping. Okay? Everybody needs to eat. Everybody needs to go out and get food and supplies. And so when you're grocery shopping, please, please, please keep that distance from each other. Avoid touching your hands to your face, and do wash your hands as frequently as you can, whether it be with soap and water or whether it's with this hand sanitizer. There has been a discussion about whether you need to sanitize everything that comes home with you. The likeliness of that happening is still on the low side. If you were to theoretically eat something that has COVID-19 on it, your stomach acid would just kill it, but it's still reaching your mucous membrane. You still would have touched the food that you ate and possibly rubbed your face with it. So it's really hard to say whether or not you can actually get it from the food itself. I know there's been a lot of concern about eating meat because of COVID-19, because some of the meat processing plants have had a high number of infected employees. But if you were to cook all of your meat completely, it would destroy the virus. And then if you, when you get home, just to wash your fruits and vegetables with soap and water. Even just scrubbing it with water will remove the virus off of the fruit or vegetable completely as well. So do please wash your food very well. Cook your food very well. You can try to sanitize all of the packaging. Some people are going to the extreme of quarantining essentially anything that comes in, because we know on COVID-19 will last about a day on paper products, so paper and cardboard products, and then on any kind of plastic or metal surface, with the exception of copper, but any kind of stainless steel, that the COVID-19 will only survive on that surface for about 3 days. So if you quarantine anything that comes in for about 3 days, then you can feel a bit more secure in knowing that the COVID-19 has probably died off on the surface of the product that you have brought in. So that's one way of trying to avoid any kind of contamination. Just bring it in, leave it there. If you have like a package that was delivered to you, wipe it down. Let's say if you were to take out, you didn't cook and you needed some takeout and just to pick me up, then you can take the packaging that it came in. And let's say if someone who had COVID-19 was handling your styrofoam, then you should take the food out, transfer it onto a plate of your own, take the packaging, throw it in the garbage, wash your hands, and then you can enjoy your food without much worry about having any contamination of the COVID-19. So those are a few things that you can do already while the isolations are still in place. But come in the future, as time goes on, that might be something that you want to still continue doing, because despite the fact that we are reopening the economy, it doesn't mean that the virus is gone. We are in no way at a point in time where we should be relaxed about COVID-19 and thinking that it's no longer among us, but it is still. It will come back to in light of it. In Edmonton, we've done very well here. Everyone's been doing their part in trying to social distance and stay isolated, but we will likely see a little bit of an increase in infections, and we should be aware that anybody could be infected, whoever you do see. As long as you don't live with them, you don't know where they've been or whatnot. So things to do as the economy reopens is that hand hygiene and physical distancing are still in place and still the most effective way of trying to minimize infections. So continue using your soap and water, continue using your alcohol sanitizer, wear your mask wherever possible if you can, but plan ahead. Let's say if you're going to go to some place, try to minimize your time there. Try to know what you're doing there and then do what you need to do and then leave. Whether it be grocery shopping, if you go to the pharmacy to pick up your medications, call ahead so that they're done before you get there, so you don't have to wait. Let's say the 10 minutes that you need to get the prescription to you, you can just come in, say hi, pick up your medications, pay for it, and then leave. Whereas if you didn't plan ahead and you didn't call them beforehand, you would be getting into the pharmacy, you'd stand in line possibly wherever you go, and then order your prescriptions, stand and wait around some more for however long it takes, and then stand in line again to pick up your prescription. That's a lot of time that you're spending amongst other people, and so that would make a really big difference if you just planned ahead and done things beforehand. You're only there for a very short amount of time. So that goes with everything, whether it be, let's say if you're going to get your hair done and you can't do your hair at home and you must go outside and you want to take that risk, you want to get your hair done, call ahead to see if they have the precautions that they've taken to make sure that you are protected and they are protected, because they are seeing a lot of people coming in. Make sure that you have an appointment with them so that you're not standing and getting to the hair salon and there are a number of people waiting for a haircut. Those types of things worth planning ahead so that you minimize that time where you're around people. Just trying to find, let's say even people who can do things when you're out, try to do everything you need to do in one place and then go back home and find a space that's safe. where Dr. Hinshaw has always mentioned to go outside. And it's not to mean that to go outside and go to places where it's crowded, but it's just to physically be outside of the house so that you are not confined, because we have seen a lot of people go through quite a lot of stress with COVID-19, physically isolating themselves means that you're socially isolating yourself, which means that people get lonely. And that's a very, very sad fact about COVID-19. People will feel quite lonely, and when you're lonely and you're sad and you possibly are depressed, your immune system actually weakens. When you're stressed, it's actually been known, if you don't sleep as well, if you're mentally stressed or you're physically stressed, your immune system drops and you're not able to fight infections as well. You're not able to even do all the things that you normally would do because you are mentally or you're physically stressed. So that's one thing that you can really do to help make sure that you don't get stressed, is that you can go outside, get some sunshine, get some vitamin D, get some fresh air. You can see the flowers that are coming out, the green grass is green again. And you can possibly even see people that and stay physically distant, stay the 2 meters away. I have friends that are going out that are doing physical distance walks where they essentially stay about 2 meters apart, but they can still talk with each other. Because the space is so much more vast than in a room or in a physical, like a building of some sort. You can actually feel close despite not actually being close. So you don't have that barrier, and you can still go out, get some exercise. Exercise has already been known to reduce stress and help with your physical well-being. It offers endorphins that help with your mental health and for staying healthy, while still getting some community and some ability to see people and not be so lonely, unfortunately. So that's one thing that you can do. Please go out and enjoy the weather and enjoy people's company. Just try to do so safely, so that we don't cause a resurgence of like a huge peak of infections again. I do know there are some people who are saying like, well, we've gone through so much, like even if I were to get infected, it's no big deal for me. I'm, let's say, 80 years old, and like my time, if this is my time, it's my time. And I've heard that more than once, and I would urge to say that yes, if it's your time, it's your time, but don't let COVID-19 be your time. One thing is that it may not just be only your time. If you don't follow these precautions, and you put yourself at risk, you're not only putting yourself at risk, but you're putting other people at risk as well, because you may infect somebody else that you are around, and you may ultimately being your time, it will end somebody else's time as well. And I don't think that anybody wants that as well. You may not realize that's what's happening, but if you don't follow all of these precautions that we are trying to urge onto other people, you may inadvertently be causing harm to other people. And I know that by far all of you don't want to harm anybody else. You want to make sure that everybody else is doing well and does not go through this infection. So please, 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 I do urge you, do your best to follow some of these precautions for, if not only yourself, but also all the people that are around us, our whole community. and discuss this with your family as well. Your family has a big portion of your well-being as well, because if they don't follow these precautions, they very well could be passing it on to you or other people as well, because we have seen that adults and the young children, they show the infection differently. So our adults will show more symptoms, the children will not, and the children will pass it on to the adults. That's why the schools were closed. One of the first things that happened was that schools were closed. With that being said, how long is this going to last? With the economy opening up again, is everything going to get back to full normal as we used to see? And I don't know how long that will take. Most pandemics that do happen last at least a year and a half. At least a year and a half. We saw SARS was a year and a half. The last huge pandemic was the Spanish flu that lasted a year and a half to 2 years. So it does last quite some time. We're only in the first, not even 6 months yet. Really in Alberta, it's only been 2 to 3 months. Within, like, from Wuhan, it was since the beginning of the year. So really we haven't even had 6 months of this pandemic. So expect that this will be quite some time. It will be possibly another year before things will go back to what a new normal would be. How long it will take will, one part, be how well we social distance and how well we keep the COVID-19 infection contained, but also whether a vaccine will become available. Now, there's never been a vaccine for coronaviruses before. We don't have a vaccine for the common cold or for SARS or for MERS. So it's a different type of vaccine that needs to be created as compared to, let's say, the seasonal flu vaccine. We know flu viruses. If this was a flu virus, we would probably be able to generate a vaccine a lot faster. But because this is a coronavirus, it's a different virus, it's new technology that's going to be coming out. And once it comes out, we have to check to make sure, is it safe? Is it going to work? Because we don't know about reinfection and how well our body makes antibodies. Antibodies are immune cells to help fight infection. They're going to have to really go down different avenues. So there are multiple ways that researchers are trying to target this vaccine. The experts feel confident that it can be done. And because there's so many different avenues that are being explored, we see the possibility of that, of one of those, if not more than one, being successful. So the experts do believe that a vaccine can be made. It's just how long will it take to have it being done, see if it's effective, see that it's safe, and actually produce enough of it for the population for it to be rolled out and likely publicly funded for everyone. So that is in the works. We do not know how long it's going to be, but definitely I don't believe it will be in 2020. It will take a little bit longer. So in the meantime, we have to just continue being very cautious with how we go about handling our public affairs, just making sure that we stay safe for ourselves and for other people. Now, that's pretty much my talk. I know there are going to be further questions. I like having different discussions when I'm in the class with your members. But unfortunately, with social distancing, we can't do that at the moment. So if you do have any questions, feel free to contact me. My email is available. It is Linda, Linda, at palisadespharmacy.ca. So PALISADES, pharmacy, PHARMACY.ca. You can always reach me that way, or you can give me a call at the store at 780-406-0808. You'll reach either myself or my husband. His name is Carrie. He's also a pharmacist. And if you have any questions in regards to COVID-19, just give us a call, and we'll do our best to try to explain what it is and how it is and what you can do to protect yourself and your loved ones. Otherwise, please stay safe. I really do wish everyone the best, and I hope to be able to be into the classroom again sometime, to be able to give some talks again. I do really enjoy doing so, but for the time being, we may do another talk on video if you guys enjoy this, and we'll go from there. So I hope you'd enjoy this. I hope you found it beneficial to you, and if you do have any questions, don't hesitate to reach out to us. With that, we'll have a good night. Bye.